My name is Dr. Gil Lederman. I'm here with Mr. Ralph Florio, and we're here to talk and learn about prostate cancer. Ralph, thank you for having us in your home.
Sure, anytime.
So we've known each other for a long time.
12 years.
12 years. So going back to
2005.
what happened then?
I noticed that my PSA was going up. I take physicals. I've been taking them since 1999. And when they started taking the PSA, again, I keep a log of every year that I go, but all the blood work and the numbers associated with that.
You do it all yourself. This is your own.
Yeah, this is my own. Yeah, this is my own
So you're very
idea.
methodical.
Right. And what I noticed with my PSA is that it was going up a little bit every year.
What was it in 99 and 2005?
Okay, it started out as 0.9. Then it went up to 1.1. Then 1.8, 2.1. Finally, in 2005, it went up to 3.3, and I decided to look into it.
So it went up a lot, it more than tripled.
Right. Yeah. And even though it was below the 4, that supposedly the 4 is the magic number.
Well, but this is a good teaching point that
Right.
you can have prostate cancer at any level
Thank
of
you.
PSA,
Exactly.
including 1 and 2 and 3 and 4 and
Right.
24.
So, make a long story
Did your
short.
doctor notice it? Or
No. This is nothing. The last one was 3.3, and the doctor says, "Oh, it's below 4. That's that's good."
So he reassured you everything was okay.
Right. See, the thing is, they didn't have the chart that I had.
But he had a chart. He was doing all the
Right,
bloods, right?
right.
He had all the bloods.
Right.
So you have a doctor, and the PSA tripled,
Right, but this was just a general practitioner. This was not.
but he was
a
ordering
urologist.
the PSA, right?
Oh yeah, they as part of the annual physical, the PSA was added on whenever it was added on. I
So
don't
he
know.
was doing it, but he wasn't really noticing it was creeping up.
Right. The important part is that I was charting it and keeping track on
When
it.
did you become alarmed? When it doubled or tripled? Or
When it was 3.3, it had gone up from 2 something.
no, but it was 0.9. It went from 0.9 to 1
Right.
to 2 to.
Right. Over the course of several years, though, it wasn't something that happened overnight.
So there was a PSA velocity that went from 0.9 to 1 to 2 to 3 to more than 3. What did your doctor say about that?
He really didn't say anything about it, but I sort of not convinced him, but I encouraged him to the fact that I think I should get a biopsy to make sure, to rule it out if there's no problem.
Were you
Okay?
worried that there was a possibility of cancer at that time? I mean, did you take his reassurance it's less than 4, it's okay? Or did you worry, wow, the velocity
No,
is high?
the fact that it was going up little by little over the years convinced me, not that there was something wrong, but let's find out if there's anything wrong and see what we could do about it.
So you saw a urologist, and
Right.
what was that interaction?
He was a very nice fellow, very nice doctor, very cordial, friendly dude, and he gave me a biopsy, and long story short, I ended up having prostate cancer.
And what did he recommend to you?
He recommended surgery,
Okay.
and
And what was your feeling about that?
I said, no, I don't want surgery.
Why?
Because I didn't want to get cut open.
Why?
Because there's a long healing process involved. I really didn't know much about it, okay? It's not something that you really know about until you have something, and then you might look into it and check things out.
A lot of people falsely believe if you have the surgery, everything's going to be okay.
Right.
Did you believe that, or not necessarily?
I just didn't want to have surgery.
Under any circumstances?
Any circumstances. So I knew that a prominent New Yorker used Dr. Lederman as treatment. So I made an appointment to see the doctor.
What's your memory of that visit?
What, a friendly fellow.
Well, that we know. Intelligent, handsome, but...
Well, no, not really, not handsome, but...
Okay. So what was your memory? What kind of words were used, and advice or recommendation or choices? What kind of things happened to that visit?
I met a couple of nice people there, very, very cordial.
Patients or staff?
Staff. Well, people I really didn't interact with them, but the staff I interacted with, and they were very nice people.
So you chose to have our treatment.
Right.
And do you remember going through the data when we first met? I show you the book.
You showed me the book, and you showed me all the information on the cure. I hate to say the word cure. Okay, can I say the word cure?
It's free country. You can say you want.
The cure rate on my particular problem was 90%, and I figured that was a pretty good odds that the doctor will be able to take care of me.
So you were comfortable with the data, and
right.
Was there any hesitation about?
Oh no, not at all. No hesitation to get this treatment, because I definitely wasn't not going to get operated on, and the fact was I had to take care of it. I have a fairly big family. They still need me, and I wanted to be around a little bit longer.
So what was your memory of the treatment? Then the treatment started. This is more than a decade ago. So.
Right. The treatment was. It's hard to describe because it's such a simple thing that you do.
Simple to the patient.
Right.
To someone who's never seen our work, how would you describe your experience getting treatment?
They make a mold of your body so you're in the same exact position every time you get a treatment. Okay.
Was it painful?
No, not at all. Was
it claustrophobic?
There's absolutely no pain, and I'm a person that's become claustrophobic, and this is not anything. There is no claustrophobia involved in this treatment.
So there was no claustrophobia, there was no pain.
No pain.
Whatsoever.
Right.
And how long would a treatment take?
I say between 10 and 15 minutes.
Now I remember, just as a side, you're a biker.
Right.
And you'd bike from home to Manhattan, which was 25 miles, something like that?
Between 10 and 15 on certain days. Sometimes it's a little longer, but we'll say about between 15 and 20 miles a day.
So on a typical day, you'd bike from Brooklyn to Manhattan, 15, 20 miles. You'd go to work full time, and you'd have a treatment, and you'd go back and do your work, and you'd bike back home.
Exactly.
What was it like to do all that every day?
Outside the fact that I had to get treated for cancer, it was just a normal day. No side effects, no weakness, nothing. My regular routine was followed, even though I was getting treated for cancer.
So you biked every day, you showed up at work on time every day.
Exactly.
You worked a full day, and you went home, and at home you carried on all your normal activities.
Right, exactly.
Were there any changes in your life during that period of time?
Nope, no changes at all. My life was just normal, a normal existence. Outside the fact that I was getting treated for cancer, but those treatments were, to say like I wasn't getting any treatment because I had no side effects, no ill effects, nothing. I was just able to carry on my normal day.
What were side effects that you had during the treatment?
I had no side effects at all.
None whatsoever?
Zero.
And you worked at a big company,
right,
and you probably came across dozens of people every day while you're working.
Right.
Did those dozens of people know or recognize that you were getting treated for cancer?
The only people that knew were the people I told.
If someone wasn't told, would they have known that you were getting treated?
No, not at all. No, not at all. No, there's you don't. Your appearance doesn't change. Your demeanor doesn't change. Everything is great.
So the treatment ended.
Right.
And then the follow-up period started, right?
Right.
So what has it been like? How often do we see each other? What's it like? What's your experience? What have you felt?
Every 6 months I'd see the doctor, and he'd give me a PSA. He'd take the blood work for a PSA, and it was going down every year or every test up until the point that it was in 2005 it was 3.3, and my last PSA was 0.04.
It's down by 99%.
Right.
And we'd say in remission, right?
I would think so, yeah.
And every test is lower. Now before the 0.04, it was at a very famous number.
Yeah,
right?
It was 0.07, James Bond.
You were 007, right. And I like that 007.
Right. Yeah, that's what we're going to be known as.
You're 007.
Even though it goes down to, say, next time, 2.02, I'm still going to be called 007.
Now, sometimes you call a radio show, right. And I introduce you as 007,
yes,
right?
Yes, you do.
And you tell your story. Tell us, what kind of side effects or quality of life do you have now more than a decade later?
I have no side effects at all.
So do you urinate the same way you did before?
Sure. Yeah, I perform sexually the same way.
That's 3 times a day, I understand?
Yeah, we're getting there. We're working on that.
We're
working on that. Yeah,
so you're sexually active, you're urinating, your weight, your strength, your stamina, your bowels, your bladder.
Yeah, I have no problem with any of that stuff, believe it or not. Even though I'm 69 years old, people want to know what kind of pills you take. I say I take no prescription medication. I take nothing.
So you're sexually active. Everything's going naturally.
Right.
And tell me, you have a friend. You often talk about your friend who plays bocce with you.
Well, not anymore. He can't.
Okay, but this is a man you described about a little bit older than you, and he chose to have robotic
surgery. Yeah.
You remember why he chose that?
Because he was sold a bill of goods that this was the greatest thing that was ever invented.
Because did you know him before the radical prostatectomy?
Yeah, I knew him. Yeah, and I knew he wouldn't listen to what I would tell him because he was a hard-headed kind of guy.
So he chose robotic.
What
did you tell him about your experience? Did you tell him, or you didn't think it was worthwhile?
I didn't think it was worthwhile because I just didn't want to what we call rub it in to him, because the after effects of his robotic surgery.
Can you describe what?
Yeah, he's sexually inactive now. He can't perform that way. His incontinence, I'm not sure about that. That he never mentioned.
And the cancer?
And it came back at one point. At one point during.
So it came back. So that means the cancer is growing in his body now.
He didn't. I haven't really talked to him that much.
So you said he stopped coming to the bocce club.
Why? Because he wasn't feeling very well.
Did he have the strength to come to the bocce club?
Not really. No, he had to do some. He had to take some chemotherapy pills. I'm not too sure.
So if he's on chemo, that means the cancer's come back.
Right. Every way that the doctor says robotic surgery, the bad effects of it, this guy had. I'm eyewitness to it.
Did he ever say to you, "Gosh, I wish I didn't"?
No, he never. No, he's not that kind of guy. He would never do that. He's too prideful about himself. And
there's not too many men who will talk about their private life, and I appreciate you explaining, because most men don't talk about their private life to other men, and unfortunately, because of that, many men get surgery because they don't really know what happens after the surgery.
Right. That's I think that's the big thing. They don't know the side effects of getting operated on.
A few weeks ago, I was on the radio, and a man called up with a Gleason 7 cancer, had robotic surgery, and I asked him, how did it go? And he said it was great. And I said, well, tell me something. What's your PSA now? He said, well, your PSA is going up. And I said, well, how can you say robotic surgery was great if the PSA is going up? It means it didn't work. He says, you're right, Dr. Lederman. And I said, well, how's your sex life? And he said, well, the sex life stopped with robotic surgery. And I said, how can you tell people your robotic surgery was great and your sex life stopped? And I said, what about urine? And he said, well, I don't have control. I said, well, how can you tell other men your surgery was great, the cancer came back, the sex life finished, there's no more erections, and you have no control of your urine? And when you say it's great, you mislead other men to get radical surgery, even though your surgery was a complete failure.
Yeah, I heard that program, as a matter of fact.
You heard the man?
I heard.
What do you think? Do you think
I said, how could this fella think that he's okay when he named every side effect that robotic surgery has?
So why do you think men do that to other men?
I don't think they care. I don't think that fella cared that his message gets through to somebody.
And harms other people, harms thousands of people.
Of course, I know it, but you gotta push your treatment.
No, but I can't push. You might remember, but when I come in and see a patient, I don't push anything. Do you feel I pushed you?
No, not at all.
I say you can have surgery. This is the result. You can have radiation. This is the result. You can have our treatment. I think it's up to each patient to decide on their own.
Well, you're right. You're right. You're the president of the United States of your body.
And that's how it should be. The problem is that most people don't get accurate information to make a good decision. And that's why I give the book. I give the book to everyone. In fact, we're making this video, and the purpose of this video is actually to distribute to people who want to have more information about prostate cancer. What other parting comments would you make to men who have investigating cancer treatment, prostate cancer treatment? What would you tell them?
I'm going to tell them exactly how I feel right now.
Yeah, please do.
Okay. If you're diagnosed with prostate cancer is the only thing I can talk about. I can't talk about lung cancer or any other type. Prostate cancer. Get over it, first of all, because I know myself, I was pretty shocked by the fact that I had cancer. But I quickly got over it, got treatment for the doctor. I refused to get surgery. Chemotherapy was another thing that I would just never, I probably would never do it, because the side effects of that are, we all know what chemotherapy does to people. Dr. Lederman's treatment, I was able to lead a normal life, no weakness, no nausea. I was able to bicycle to work on the days that I could bicycle, because it was towards fall, and sometimes fall is a little strange with the weather, with the rain, and maybe a little bit too cold. But I just carried on a normal life, because the treatments had, the only effects that it has was it got my PSA down to 0.07.
0.004. 0.004.
Okay.
0.04.
Right.
I just want to make one more question to you. Since that last treatment 12 years ago, have you had any other treatment, Lupron, chemo, surgery, anything else for the prostate cancer?
No other treatment.
Only our treatment.
Other than the treatments that ended the day after Thanksgiving on 2005.
That was your last treatment. You had no hormones, chemo, surgery, nothing.
Nothing.
You've been totally treatment-free,
Right.
cancer-free
Right.
for 12 years.
Right. Still rocking and rolling.
Thank you very much. God bless you. Thank you.
Okay.